Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome to this episode of Family Practice. I'm Dr. Jeff Fox. Tonight, New Year's is coming and we're going to talk healthcare resolutions. We're going to meet a hospital chaplain and learn what they do. And does less sunlight make you depressed? We're going to talk about seasonal affective disorder. That and ExploreCast, a new podcast, is here. And my first guest is Dr. Joe Gerhardstein, and commonly known as Dr. Joe, one of my colleagues at Family Practice Associates, and you've agreed to come in here and talk about healthcare resolutions.
Thanks, Jeff.
So let's start. How about checking your insurance might be a good one?
Well, most insurances will pay for some kind of wellness exam, even the private insurances for people 65 and under. But even Medicare now will pay for some kind of wellness checkup that is paid for by insurance 100%.
Now, at the first of the year, you probably need to know what your deductible is or who's in your network. Does that change?
Unfortunately, it changes every year. There's been some insurances that have had problems with hospitals, and hospitals weren't par with some insurances. Medications are on different formularies. Sometimes at the beginning of the year, you have to switch from brand A to brand B because of formulary, or you can pay through the nose.
Yeah, for sure. Okay, how about sleep? Is that important healthcare-wise?
You know, I think if you get up early enough, drink enough caffeine, you shouldn't have to worry too much about the sleep. Obviously, that's not the case. We recommend a set wake-up time, set go-to-sleep time, some kind of exercise throughout the day. Usually we run 90 miles an hour all day long, sit down, watch TV in the night, and then can't fall asleep because we've been looking at too many screens throughout the day.
So that kind of ties into getting sleep, but also eating well, exercising. Everybody's got that.
It's bad for my business if people eat right and exercise because they don't come in to see me. Okay, if you eat a healthy diet, keep a healthy weight, you're a lot healthier, you'll sleep a lot better, you live a lot longer and have to see me less.
Now, the new weight loss drugs are the fad now.
There's several weight loss drugs. You know, you say they're new and they're comparatively new. They've been out for several decades now. Now, they've only been recently used for weight loss. They've been used for a lot for diabetes management. And as a side effect, people are finding that they're less hungry, they're eating less, getting a healthier weight, and now we're using them for that as well, and with a lot of success.
Also, how about mental health? Is that important in terms of healthcare resolutions?
Well, if you eat right and exercise and get right, you should be healthier. This time in life, there's a lot, you know, we're running 90 miles an hour, we're not getting enough sleep, we're not getting rest. And it plays on our physical as well as mental health.
All right. Quit smoking and limit alcohol. That's everybody's New Year's resolution.
It's a big New Year's resolution, and I can't say enough about not smoking. We have several medications out there. You know, you may have somebody that's been smoking 20, 30, 40 years. Their brain is used to that. We have some medications we can help them to ease off of the cigarettes and get into a healthier routine.
Now, you also mentioned when we first started this preventive care. It's always important to get your yearly checkup, and what happens when that occurs?
You know, the yearly checkup varies depending on your age, obviously. Little kids get little checkups and have lots of different vaccinations. And as adult, we have vaccinations as well, as far as making sure you've had your flu shot, making sure you've had your pneumonia shot, make sure you get your blood pressure checked. And then there's a lot of different cancer screenings that we do based on your age.
Now, you mentioned some of those. What might somebody want to?
Well, unfortunately, here in Kentucky, a lot of people smoke. We have a lung cancer screening CT scan that we recommend. The olden days when you and I practiced, we did something called a flexible sigmoidoscopy, part of a colon cancer screen. I haven't done one of those in decades. We now have colonoscopies that we recommend. We've recently changed the screening age from 50 down to 45.
Well, we thank you for coming in. We thank you for keeping us healthy, and we thank you for all the work you do.
Thanks, Jeff.
And if you haven't made one of these resolutions, it's time to get healthy. We'll be right back.